welcome you this afternoon to the UNBC speaker series. My name is Ed Harrison. I'm just filling in for Phil Burton, who's the chair. I'd like to introduce Verna McDonald. She's not going to be professing education today, but rather talking about Lyme disease, of which she has some direct experience. So with that brief introduction, I would like to introduce to you Verna McDonald.
Thank you so much for coming. It's a pleasure to be here. And right from the first conversations, checking in with Brenda and this journey that we're all on as to what's going on globally, what's going on in North America, what's going on in Canada, and more specifically the map that we were just looking at, Alex and I, what's going on in British Columbia in terms of whatever it is you want to call it, however it is you see it written. So sometimes you see Lyme like the fruit. Sometimes you see Lyme like Lyme, Connecticut, where the juvenile arthritis outbreak occurred in '77 that flagged folks in that part of New York and Connecticut. Or you'll see it as a plural Lymes or borreliosis. Or sometimes, if you're reading articles and such, you'll see it this way, which stands for borrelia burgdorferi, which is the name of the most common form of Lyme bacteria that we see on the West Coast, or probably in North America. So, that said, what I wanted to look at after 2.5 years now of exploring my own questions was what some of your questions are at the same time. So the information I'm presenting today on Lyme is not from a scientist. There's so many scientists involved in this study. Entomologists looking at insect patterns and the transmission vectors, geographers looking at what geographical areas are most endemic, biochemists looking at which types of Lyme are present in which ticks or which insects, foresters looking at what their forest supports in terms of vectors, municipalities looking at what's going on in their municipality. So many scientists, and that doesn't even include medical folks and all of the work that's going on at every level there. So I'm only speaking as one Northwestern resident patient today. But I have done a bit of research, so we'll look at some of that too. My own knowledge base is evolving daily as I learn, whether I'm looking up Lyme organizations on the website, of which there are now many, and a great deal of well-organized information, so I'll point you to some of those. Looking at new research, Sabina Lautensack sent me a new one the other day coming from SFU, looking at books, listening to doctors, other patients, etc. And then where that has become focused for me is on this series of questions and controversies that are both representative of some of my learning and some of my questions, and also what's going on internationally or nationally, like Bill C-442, which some of you may have heard of as the first Green Party legislation in Canada. And of course, I'm celebrating because it was Lyme, not so much because it was legislation. Rare to have a member's bill pass both houses unanimously, and then what's coming out of that is now a conference. This is kind of the style that's going on with Lyme research, because it takes all of us. Takes all of us. So patients, organizations, universities, pharmaceutical companies are involved, doctors, biological, I was going to say engineers, but that would not be the word for folks working with DNA, whatever that word might be. But the community of learners is huge. So what Bill C-442 did was commit Canadian knowledge holders to start a conference and look at how do we join the global conversation versus tagging along with our neighbors, as we often do. Let the US figure it out and we'll kind of, well, it's very, very different here. So that's now an active process going on. Let's see who's here. So if you don't mind raising a hand, if any of these might fit. First of all, have you watched a documentary on Lyme disease? or read articles on Lyme disease. So we know that Suzuki's Nature of Things documentary that came out, I think it was 2012, has made a huge impact. And then the skin one, which now has a second version, a second CD. So yeah, there's some really good resources there in terms of documentaries. How many of you have a friend or a family member with Lyme symptoms that are either documented, tested, or not? So lots of folks, more than half of us. How many of you, and you may have your hand up several times, that's fine too. How many of you have a medical interest? Or a different professional interest? I was really surprised as an educator to find out in terms of the Lyme mimicking conditions, where a condition like MS might be a CNS demyelination of nerve structures, usually focused in the central nervous system. That's a whole different thing from what's now called Lyme MS, which is a different biochemical demyelinization, and it may or may not be focused in central nervous system. Mine is peripheral nervous system, so my hands and feet do very strange things. And I'm almost out of that, where they can go numb or tingly, or tendon resistance, where they clench, or tremors, or whatever. I haven't had much of that for the last 4 or 5 months, so. And I can even shake hands.
Look at that.
Where it used to be impossible. So, okay, our tech wizard is here. Alex, I apologize. To folks who may be watching from other regions or other areas, sorry, I just walked off screen, but I really was proud of myself to be able to shake hands, so I wanted to do that. How many of you are just wondering about what's going on in our area in the Northwest? Yeah, it's a concern for all of us. And how many have curious symptoms yourself? What I call my telephone pole leg was my first curious symptom. So that was in August, September of 2013. And the different, thank you, sir. Alex has rescued me yet again, remote with batteries. And that's one of the markers of Lyme, is the oddities of the symptoms and the cyclic nature. They move around. They move around over time, and they move around in the body. So that's one of the big flags for think about this, look into this, start documenting your symptoms, your symptoms, as if they're moving around. So, test. Lyme disease is rare in Canada, true or false?
False.
Lots of cases, it depends what you're comparing it to. So if you're comparing it to, say, the northeastern seaboard of the United States, you might say it's rare compared to that. But it's not rare compared to a lot of other conditions. Number 2, doctors treating Lyme disease effectively may face investigation and lose their medical licenses in North America.
True. That's true.
That's true. Lyme disease is only transmitted by black-legged deer ticks.
False.
False, and the number of transmission vectors are increasing all the time. You guys are awesome, I can just go home. Ixodes pacifica ticks are the main Lyme carrier in BC.
Can I ask a question? Why number 2? What? I
Yeah.
don't understand that.
We'll be getting into that. And some of the cases that are in the documentaries are being followed sometimes in their own documentaries. So this is one of the main big questions that we'll look at. Has it happened here yet? Not that I know of. But there are folks that are on my team that have had that happen, where there's an investigation started, usually over the amount of antibiotics being prescribed and whether or not serological or blood testing documents your Lyme and what you have. One protocol is so bizarre that step number 1 is bringing somebody a live tick. Okay, how many of us notice when we're bitten by mosquitoes, spiders, ticks? You sort of might notice, or you might even not notice, but you certainly don't collect them and send them into the lab. it has happened, and there's about 90 went in this year across BC where the tick was actually saved and sent in. So yes, those are the kinds of issues we're going to look at. Great question. True or false? Lyme disease or Lyme borreliosis is an acute bacterial infection. True, that's one of its forms. 2 to 4 weeks of antibiotics generally cures Lyme disease. True or false? False, and we don't know too much about the far chronic end in terms of real specifics, numbers of cases, types of symptoms because of the mimic factor, like Lyme arthritis. So how many cases of arthritis are actually the deterioration of the cartilage in the joint and the subsequent inflammation, et cetera, and then how many of those cases is that inflammation condition triggered by Lyme spirochetes? We don't know that anywhere in the world. Canadian treatment protocols are based on current and effective international treatment guidelines. False. That's why Bill C-442 and the resulting call for a large-scale conference with all representatives in that conference to try and come up with what would it be if it was. That was one of Elizabeth May's main points in doing that, was how to get Canada into, I used to say best practices, but the more I read about the oil and gas industry, the more I see how that can be a fog because it's not documentable. It's not, how do you make somebody accountable or responsible for best practices? Is your diet following best practices? Well, what would that be? So there's these kinds of big questions that are coming into the picture of Lyme, is what do we actually mean by some of those things? Some of the major questions we'll look at: what, where, when, why, and who involve Lyme borreliosis and the regional specific co-infections that go with it. So one of the reasons our Lyme in 2016 is so different than what you might find in the teeth of an Egyptian mummy, I read that one somewhere, that has been, spirochetes have been found in the teeth, is the fact that these co-infections make it so much more complicated, both the symptoms, how do you test for it, how do you treat, and which one are you treating first, that kind of thing. Where is Lyme, of course, which brought some of you into the room, and is it here? The answer to that is yes. Yes. When, from the ancient times to the 20th century, World War II particularly, in terms of biochemical labs in Germany, Japan, Russia, and the US, and then current information. So the most current information I had about why am I interested in this was driving here. In my neighborhood, there was a young woman and a little guy about 3, and he's got the adult rake, and he's out there trying to rake, and she's kind of talking him through how to rake. And that's my interest as an educator, is what's the impact on our young people. So, and then as myself, at the other end of the scale, are folks who have, shall we say, a few decades on them. Why investigate? Because of the impact of these co-infections is my investigation now. So the Lyme borreliosis is pretty much under control. Bartonella has dropped from being the highest on the record of the lab in Palo Alto that we were using, such that the director of the lab called my doctor to say, you probably should do something about this. And that was the Bartonella infection, which sometimes is known as cat scratch fever, but that's not the version I have. We're now up to approaching 100 different varieties globally of Bartonella as a co-infection with Lyme. So again, the patient documenting, are your symptoms getting better or worse? Just like we were talking about what's making that better and what today made it worse. That's how simple I've gotten, just because the whole scope of the thing is huge. So I'm constantly getting better in something, and that's very, very, very encouraging. And I think that's true globally. We're all, different countries are getting much better at different aspects of treating Lyme. Like Germany is probably leading in homeopathics and combinations of treatments, rotating treatments, pulsing treatments for 5 days, 4 days, 3 days, 4 weeks, different ways of kind of fooling these bacteria. So why is it so different now? Experimentation with biozoonotic weapons in World War II, particularly in Germany, Japan, Russia, and the US. So in the Black Forest area of Germany, there are doctors who can read a symptom list or have you tell them a symptom list, and they will tell you which type of Lyme you have and which co-infections you have. And then you document your symptoms a bit, work with them, and they treat you for those things until something else rises to the surface. So you may heal, say, borrelia burgdorferi, the most common here in North America, Lyme bacteria. I should say the west coast of North America, actually. And then the Bartonella pops up, and you have a different set of symptoms. Who is involved in these questions? Well, borrelia is North America's fastest growing vector-borne infection, so it really involves all of us. It's a global issue. Now for the picture part. You love these guys, right? So at first, these kind of things made me really anxious. And then I went, well, I started teaching in Telegraph Creek in BC, and then taught in Pavilion outside of Lillooet and Chouchua outside of Clearwater, and was dealing with ticks all the time. So why is it such a big deal now? I would be dealing with them on my cat or my dog or my horse or myself or my students, mostly students, little ones. And we had ways of removing them that you wouldn't use now. Like the match trick, anybody done that one? Or a couple of drops of kerosene, or just kind of rub them out or dig them out with something. So now they're telling us because of these infections, like just a tick bite will create a reaction, of course. A tick bite with Lyme will create a bigger reaction. But most of the time, or a lot of the time, the body's immune system will just deal with that. With these multiple co-infections, we're really gentling down to how you remove the tick. And there's actually, I just read an article about, go to your local pet store, because they have awesome tick removers that you use on pets. And you're often with the pet working on thin skin areas, particularly ears, sometimes groin, and they're just odd looking little hook tweezers that you gently grab the little guy and gently pull them straight out. So the tick isn't having a fit. Now I never thought about that. If I bring a match up to this tick, imagine a flame rolling into this room. So we'd all do a major biochemical response to that flame, as do the ticks. And they kick out both the anesthetizing saliva and the contents of their stomach. Well, that's how your infection is going to magnify. So even if it wasn't embedded long enough for you to get an infection, if I did something like that to it, I could have one really fast, where they might say it would take some time otherwise. So the other thing about these things, if you think of the scale here, what else do you notice? These are not the ticks I dealt with in Telegraph Creek, which were half of a good-sized mosquito and then quite round. These, in the nymphal stages, larval stages, can still bite you, and if they've been infected by the adult, which generally happens with the eggs, they can still transmit an infection. That's partly why it takes longer or shorter periods of time for a Lyme infection to be transmitted to a human or its mammal host. Like this adult will take a shorter period of time because it has so much more bacterial content. So that's another thing is, if our Lyme protocol is written to mean you need to know you had a tick bite, much less you need to save the tick, am I going to notice if this little guy bites me? Especially when they love my hair, specifically that thin skin behind the ears, right? So do I check that frequently? What I learned was you can actually check with your fingers. So that's pretty easy. It feels like just a little wee scab. Or in my case, how many of you know you've been bitten by a mosquito? Absolutely. So if your doctor says, when was the last time you were bitten by a mosquito, what are you going to come up with?
It tears.
Laughter, yes! That would be a good thing to come up with. Laughter. So of course you can't tell them my last mosquito bite, let's see, fall, I'm guessing October 30th, whatever. So if you require that of a patient who's already really distressed with whatever symptoms they have, and that's why they're sitting there talking to you, just that can be so intimidating. Does that mean you're not listening to me? Because I can't say February 3rd, it's not February 3rd, what is it, 17? February 17, 2016 at 12:23, I was bitten by a tick. So whether I know I was bitten or not, and then where I was bitten, some of us know that, some of us don't. I know at least where a couple of them were, but those will change your symptoms. So that's why the telephone pole leg is because my bite that in my head I associate with the beginning of all that was at the ankle. So if it had been behind the ear, the symptoms could be quite different.
Verna,
Mm-hmm.
how frequent are ticks here? I mean, I grew up in Saskatchewan, and when we'd come in at night, we would have ticks removed every day. But I've only seen one tick in 10 years here. And I don't know if that's a common thing or uncommon.
Well, we'll get into that. The estimation is right now less than 1% of the ticks that most often are carrying borrelia burgdorferi, or whichever version of Lyme they might be carrying, are found here in BC. And eventually we'll pull up the BC map that shows you where it's endemic. So ticks are the most researched vectors. What little guy am I stepping on? It's only a tack. Start talking about ticks and I feel them everywhere. It's only a tack. So the ticks are most...
There's a question.
I don't know if I heard clearly. I'm out in the boonies, I get a tick. How do I remove it? I can't go to a pet store.
The theme of that, regardless of what implement you use, tweezers of course being the most likely to be around the house, is be gentle. So it's even better if somebody else is around. You can certainly do it yourself, but if somebody else is around, they're more likely to be relaxed and gentle and pulling in the direction the tick went in, and then that's your best chance for having no more contents dumped into you, because you're just very gently going, okay, I'm inviting you back out of here. So, although ticks are the most researched, other insects also carry the infection. And a young tick as small as a period, or often called poppy seed ticks, can transmit the infection. Also mosquitoes, fleas, mites, horseflies, and spiders have been documented. The life cycle of one host, and this is Ixodes scapularis, which is not the one most found here, the Pacifica tick, but the life cycle is of course the same. Adult transmits to eggs, eggs drop, become larvae, the tick seeks a host, and in some ways it's correlated to the size of the mammal, in other ways it's not. So the mouse gets a really bad rap here for the larva using the mouse as a host, and then when they start morphing into the next stage, they drop off as a nymph and look for, it isn't necessarily a larger host, but often foxes, dogs, cats, and any of them can go to people, it depends who comes by. They love to track you by CO2, track mammals actually, I shouldn't say track you now, I'm getting paranoid. So ticks track populations of mammals by CO2 emissions, and they love being around trails because that's where that would be the most common. And in each of those stages, if you're bitten, larva, nymph, or adult, you can end up with an infection, or not. As we said, if only 1% of the ticks being documented have the infection, then don't panic here about being bitten. It's pretty unlikely that the tick that decided you look like lunch would have multiple co-infections with borrelia. So in Canada, the black-legged tick has become established more in the east and in Manitoba. And the western black-legged tick, Pacificus, is the one that occurs most in British Columbia. And they're the species most likely to transmit Lyme or borrelia burgdorferi. These ticks can also carry other less common infectious agents. That's where the medical, diagnostic, and treatment complexity comes in, is the other agents. So just having Lyme disease it's still going to be acute, possibly chronic. It's going to take time. It's going to take treatment. Your immune system can handle it if you're in optimum health, even being bitten. So folks who hike a lot might worry about that, but they're possibly part of the population that might be the healthiest and with the healthiest immune system. Whereas if you're under major stress and your immune system is flagging, it's more likely that an infection would result. So other tick species do also transmit the bacteria. And in BC, most of them live in the nests and burrows of their little wild animal hosts. So that's good news for us, that there's so many mammals to choose from that they'll choose the ones closest to them, and they're closest to the ground. So they really like that whole burrow, ground, little host. And probably our squirrel population, if it was tested, would have borrelia. Some preferred hosts in the tick life cycle. White-tailed deer and mouse get kind of the worst rap or the most publicity, and in some areas they're pretty much the focus. In other areas it really, really varies. And dogs who live in this kind of an area, and it's a high endemic area for both ticks and for infected ticks, then I'd be checking my dog pretty regularly. They don't show symptoms quickly, but our veterinarians, I've talked to 2 of them here in our area, they're really good about Lyme. They would test me the same test that they would test my cat, the same test that the doctor eventually used on me that we sent away to California. Now we're going to look at a series that goes to Germany, but the vets know all this. You can have a great old conversation about them with Lyme, because dogs can be targets, especially things like that lying in the grass or the leaves. In Canada, the reason that north, east, and west coast population became an issue here is because of our huge migratory bird populations. So we're on quite a few flyways, either very directly or indirectly. And again, around the ears, I've never thought too much about bird ears, but if you go to the web and Google any of these things, you'll just get masses of pictures. Like Teresa did the other day, we were looking for something, and there's all these pictures of birds and ticks that have already had their lunch, so they're already engorged around the birds' heads. I have big windows at home, and just about every day in the summer until I put things in the windows, which I have now, I would have a bird hit the window, and I've never yet seen one that had those engorged kind of things that I see on the web. So research study of one. And then squirrels. So people are not their least preferred if we're easily available, but they're also not in any way seeking us out. They're very happy if the host comes to them, which is really likely in our forest. Some of the Lyme aspects that are being really highly debated you've brought up, which is the vectors of transmission. We talked about that. Which animals are carrying ticks and where do they carry them? Canada geese were one of the first that were explored, and I don't know where that research is now or if it's still going. Which bacterial strains of the 130 plus borrelia versions of that bacteria have been identified? Which type of infection forms? The vocabulary of Lyme is something I've started to learn, but it still boggles me that I would have to take out my dictionary when I'm reading these articles and go, okay, what's a bleb? What's a biofilm? What's a borrelia cyst? What is an intracellular vacuole? But the point is that the spirochete that you see most often as the bacterial form, that little spiral guy, it's actually not the helical 3D spiral, it's more of a wiggly spiral, but that's only one form that the bacteria take as they work with or against our immune systems and our different systems. Another complicating factor is what diseases you've had in the past, because sometimes those will activate, and then you have another set of interactions going on. So testing, some of the debates there are what are the limitations, and everyone that's worked with me has been real clear on that. what they're looking for, what the limitations might be, and what it tells us if it's positive. And then the possibilities given timing. So if you want to test right away after your bite because you've identified it as what you think is a tick bite, or in that ideal scenario, you have the tick bite right there and go, I need to be tested. The spirochetes need time, not a whole lot, to disseminate through the blood system, and that's the most often given test. So if I was bitten on my ankle and blood is drawn from my elbow, there may or may not be spirochetes there quickly. So that's one issue. Then another issue is whether or not the spirochetes in the blood begin to make other forms, like those little cyst forms that may have proteins around them, are hard to identify, and may or may not be in the blood. So then how are you going to identify me? That's a whole other issue. And then the symptoms and how much they change has been very difficult for practitioners, doctors, diagnosticians to get a hold of. How does this symptom set look like Lyme? Unless it's one of the sort of classic, the Lyme arthritis, Bell's palsy, where the main nerve in the back of the head is impacted, and it impacts generally one side of the face, or the classic undifferentiated myalgia. My muscles hurt everywhere all the time, except maybe not all the time, because it tends to be in 4-week or so cycles. It will get much stronger. So that starts to get complicated. If it's in a joint, sometimes it will stay in that joint for a while. Knees were one of the indicators for diagnosticians for a while. If there's an unexplained, fairly rapid, what seems to be arthritis, but it has really weird swelling and different colors, rashes, etc., that was an indicator. And then the EM rash, which I'll show you some pictures of. So treatment might be no treatment. Your immune system handles it. You were in tip-top shape, no stress, and you get that bite, it swells up, either just at the bite site or like my leg did, and then my immune system handles it. So that can happen. Or it may need either allopathic treatment, antibiotics being a common one, or naturopathic treatments. Acupuncture really takes my pain level right about to nothing now. Where it used to dull it out, now I can have a whole week and then go, oh, it must be time to go. So they may be naturopathic therapies. There's herbal therapies that are profound, so strong that you take them 1 drop at a time, and over 30 days, that's not accurate, sorry. You increase each week. So 1 drop twice a day for a week, 2 drops twice a day for a week, 3 drops. That's how strong they are. Really, really effective. And again, German diagnosticians are using combinations of those naturopathic, antibiotics, herbals, physical therapies. And that's what we have in Terrace, is that amazing network, that amazing combination of things. And we have really amazing people here, like our physiotherapist. So you can find your way through if there's somebody that needs help in building your team, is what I call it. And when all the brains get put together, we can find a way through. Even if it's current success. Oh, if I do half an hour with my legs up the wall twice a day, my legs don't hurt all day. Oh, good. New one. And then that symptom falls away. So another thing that's common in diagnostic and treatment literature is treat the system, as you would if you're giving the whole thing antibiotics, but also treat the symptoms. So that was one example for me, was the muscle pain, which was diagnosed as fibromyalgia, and yet is Lyme fibromyalgia. There's lots of I'll give you the Australian list in a bit, lots of different ailments now that also have a hyphen Lyme kind of a thing attached to them. It can be caused by Lyme. So for me, as soon as I started the acupuncture, that symptom just started to fade away. Doesn't mean I don't have Lyme anymore, but I've worked with that now for 2.5 years, so pretty much I'm symptom-free. Is that optimum health yet? No. And that's kind of where my reading is right now, is how then do you get back to optimum health. Prognosis, you're looking at the acute short term after the bite, often considered up to 3 months. Then you're looking at the chronic, long range, over 3 months, documented now into years or decades where spirochetes are found. And then the need for local, national, and international bacterial responses. This is my favorite, Marion. You know what really helps?
Yeah.
Quail and chickens. They love to eat ticks. So some of the endemic areas in the US, people have gone back, and I know we have here too, right? I remember reading that bylaw. We can have chickens. So that was fascinating to me. Anybody who has chickens is doing a service for all of us. They love ticks. Controversies around Lyme often depend on our perspective, our lens. Are we the patient? Are we the doctor? Are we a lab? Are we part of the media who wants to give information to everybody? What's our background knowledge? What's our purpose? What are we going to use this information for? What's our experience? Is there urgency connected with it, either in treatment or a political urgency? Imagine if you were our legislators having to decide what to do about this. It's urgent in the US. CDC just went to 300,000 cases a year, having stayed at 30,000 for a while, right? And they're now looking at, well, that was 2014. It's probably not accurate now. So if we're looking at tiny numbers documented because you needed a tick bite, or to remember you had one, or you have a blood test that confirms you have the bacteria, or you've responded really well to treatment for borrelia, which is probably an indication that all those weird symptoms probably were Lyme. So Canadians are really big question marks over our heads as to how is that impacting us. My 2 cents right now, after going back through a bunch of research to do this today, is watch and learn. Because they're figuring ways through, different ones in each state, and figuring out ways to do the specific testing. So yeah, we can learn a lot from watching, or the German health system that uses both traditional, allopathic, non-traditional, naturopathic, Chinese medicine, homeopathic, whatever will work for you. And they're having really a lot of success. So then there's our skill level in assessing information. Some of the websites are really off the wall. And some of you I've emailed in the wee hours because I'm looking at these websites trying to figure out, is there real information? What am I doing here? And click back out of that because there's so many really good websites, whether it's Mayo Clinic or the International Lyme and Associated Disease Association or the Infectious Disease Society. Very different perspectives, but really good information. And then what's my desired outcome? So lots of different questions. Before we do this wee activity, you had a question, sir?
Yeah, you're talking about chickens eating ticks. Well, what happens when we eat the chickens? I mean, are there spirochetes in the chicken?
Now there's a powerful question. I'll have to look farther on that one. And what's the incidence in beef cattle? I never had that question in my head before.
Okay.
For Lyme ticks.
Because people are having them for eggs as well, so what about the eggs?
Yeah.
In addition to eating the meat of the chicken?
Tune back in a couple of months. Dang, yeah, great question. Pretty much each one that I can get that specific on, when I Google, somebody has an answer for me. Like Mother Earth was one of the first ones that talked about one of the advantages of having your little garden and sustainable food supply on your home site. One of the advantages is your chickens will eat ticks. But they didn't say, and then what? Okay, I'm gonna look that one up. So our very lively and very different information systems, mine is now just tweaked, and part of my cognitive process is going chickens, Lyme, eggs, and that keeps happening. So for each of us, these whole information systems are really, really different, right? I'm going to ask you to take a moment to picture a photographer in your mind. Has an awesome camera setup. No, it's not Alex. Could be. Awesome camera setup, looking at a natural landscape, and looks to be a great shot. Okay, anybody got that in their head? Photographer taking a picture, great shot, northwest. Marion, what are you seeing?
Oh, I see a lightning storm and background of beautiful clouds. Yeah, I love lightning. Thunder.
And your photographer
Thunder hits.
looks like?
Oh, well, he's really handsome. He's John.
Awesome photographer. So is that a real image? Absolutely. Is that a real information system? Absolutely. And it's one perspective. Teresa, what was yours?
Field of long grass, and then the back mountains, kind of like circling with a bit of snow on top. Yeah.
Could be spring or fall. The snow line is just moving. What does your photographer look like?
He's kind of got like a round, like one of those floppy kind of like hats and plaid shirts. Yeah.
And is about ready to take this shot?
Yep.
Anybody have a different picture? Of course you did. How about this one?
I know, it's confused.
So what I love about this thought is that I have to keep that in mind whenever I'm reading about Lyme. Actually about anything, of course, but particularly Lyme because of these huge complexities. When I start oversimplifying, I get positioned and I decide these folks are right or those folks are wrong or whatever. But when I can go, Verna, it's just your perception. You're the photographer right now, and there's a whole lot of other ways to look at this. So this one in particular tweaks me, this map of endemic areas in Canada. And then I have to do is that a symptom of Lyme, Alex? Your tongue goes into knots? I have to do my step back. What perspective am I looking at this from? So for me now when I look at it, it's okay, if I was going to visit some of these areas in Brandon or Peterborough or Southwest Ontario, moving into Quebec, this is Victoria, Vancouver area, if I'm visiting there, what do I have to keep in mind around prevention? So we have a slide for that. Then we'll look at the map of BC, which shows us in green instead of these neat little, we weren't sure that would happen. So you're looking at the same thing now for just where we looked at this part. Now you're looking at that part in green, basically, plus the rest of the province. So there's optimum Lyme habitats. If you're a tick wanting to move to BC, you might want to know that. And then there's sort of medium range and fewer, and then potential, which means probably there have been some found there. In comparison to the high endemic rates of Lyme disease in northeastern US, 29 cases per 100,000 and a 40% tick infection rate, that's really high. So it's almost half if you get bitten that your tick had borrelia. Doesn't mean that is transmitted to you. Depends how long they're there and whether you startle them and all kinds of things. It might mean they're transmitting. And then the risk in BC being only 0.5 cases per 100,000. So that answers a few folks' questions about how worried should I get. Pretty low. And then if you go for Terrace, this is Prince Rupert, here's Terrace, and around us you have these valleys of light green. So what is that potential about? Here's where we're totally making it up, where I'm totally making it up. I think the valleys around Terrace are really mobile. That's one factor, humans moving around all the time. And we move big. So terracites love to travel, and we travel big and we travel to endemic areas. East Coast Canada, East Coast of the United States, California, Miami, different parts of Europe, Asia, Japan, China. Japan is endemic. So there's a whole lot of travel that can bring the infection back. Another reason is these wonderful ecological niches. Like we live in this magnificent valley that grows things. I so love that about it. But it also, of course, grows all kinds of flora and fauna that the ticks love, so mammals and etc. We're not, in my view, this is the world according to Verna, we're not in a serious concern endemic state. We are in a pay attention if you're in some of those environments. Bush, tall grass, piles of dead leaves, old compost piles that haven't been turned in and are not warm. When you work with that kind of thing, just notice. So it isn't a panic, but there is some reason to pay attention. Oh, of course it's not working. Sorry, sir. He reads my mind. He's already going back to PowerPoint. That was the map that we just looked at. So some of the different perspectives when we look at that map and think about just paying attention for prevention might be a patient's perspective who's mostly recovering or untreated, doctors and researchers, etc. Different perspectives as to how concerned and what action we might want to take. Patients often don't remember a tick bite. They may remember a long period of flu-like symptoms, which is another marker of Lyme. Flu that doesn't go away, just goes on and on and on. And then different inflammations, whether it's muscle, neck joint, knee joint, other joints, nerve pain. Again, it's the migratory nature of those symptoms. Nerve pain that one day is drilling in my ear, but it comes and goes. And then another day, I've got this tingling in the arch of my foot that's actually kind of fun. It's not painful, it's just interesting and has never been there before. So it's that migratory, unique, and odd nature of multiple symptoms that often identifies Lyme. Some patients don't go to a doctor for quite a while, and sometimes their immune system takes over, they heal on their own. Others, the symptoms get worse, and then they start looking for what kinds of treatment might work for these odd symptoms. That's when you start to get the odd questions, as in my case. So you're thinking, you had insect bites, oh, I can see that little scar. You have that odd redness, etc. And then you start looking for testing. So the bullseye rash question is a big one. Does it actually happen? And sometimes you'll read protocols, even national protocols, that say one of the markers for treatment is the bullseye rash or erythema migrans. And yet 2 to 50% of the patients in a great variety of studies can remember or have had such a rash. So yes, it might be, can take all kinds of different forms. Mine was that band around, in this case a knee, in my case the ankle. This one is one of the cases where the bacteria is slowly spreading out from the bite, which was probably in that wonderful thin skin behind the ear that the ticks really enjoy. This one is a buttock, so it became a big patchy rash. That's also common. And then this one is the inflamed bite kind of a thing, where you can see where the hole was, and then it gets an infection that starts around it and spreads red. So yes, that could happen, that you get some kind of a rash, whether it's the classic bullseye with the red in the middle and then red circle around that, or whether it's one of these other beginning to disseminate, beginning to move out types. Do you just read my mind or listen to the click, or is this actually doing something?
I hear the click.
So I'm not actually doing anything?
You are, but sometimes I switch between the video feeds.
He is
And
so
I'm a little
good.
slow on getting back.
To all the folks who might be listening out in the regions or wherever you are, you have an amazing tech right here. So, one of the big controversies, origins. How did Lyme originate? A Dr. Traub, who worked in World War II in the Tübingen lab in the Black Forest of Germany for the Nazis, was an expert in tick zoonotic diseases, diseases that ticks carry back and forth from different animals that may or may not be transmitted to humans, and got very interested in whether or not that might be a weapon that nobody would figure out. Why are these soldiers unable to fight? So that area, the Black Forest of Germany, is still one of the really high endemic areas nationally. And in the 50s, some of the scientists that had worked with the Nazis in Germany were brought by the US military to a place called Plum Island, which was not on US maps until recently. Invisible place off the coast of Long Island, New York. And some of these same things were studied, zoonotic diseases. So whatever you think of taking that on, when it became public was when Connecticut and New York experienced really real high incidences of Lyme arthritis, of unexplained migrating symptoms, of people in clusters all of a sudden looked like the whole group had gotten MS. Very odd things. The most common used as the example is 1977 in Lyme, Connecticut, because that's how it came to be known as LYME versus bacterial infection contacted through ticks. So this got to be a real political football, and the governors of New York, Cuomo I think was the first one who got really looking at this, and then Hillary Clinton when she was New York governor. And it got transferred to U.S. Department of Agriculture, looking at zoonotic diseases and then hoof and mouth and things that really were a concern among food animals became its focus. Then the FDA worked with it for a while, and right now Homeland Security is in charge of Plum Island and the bio-research labs out there. One of the issues, that island being so close to New York is also on a flyway. So how do you keep birds from landing? At one point when it was military, they had 70 sharpshooters. Their only job all day was to be at Plum Island shooting birds that were about to take off from the island and possibly transmit diseases. Pretty weird. So if those of you who like the weird outer edges of things, that was one of my late night emails, Marion.
Yeah, I love
Lab 257 is a book written by a lawyer who at the time when the governors got into it was very concerned about family members and what he was seeing. So Michael Carroll wrote that book, Lab 257, easily available on the web. Testing controversy, we've talked about a bunch of this. We haven't yet talked about the specific tests. So Canada is following the 2000 protocol of the International Disease Society of America, where they wanted what's called an ELISA blood test, which is serological. So you're testing blood for spirochetes. And we've talked about how that depends on your timing, whether you're going to find them or not. But we're using the two-tiered method. So this one has to show up positive, spirochetes in the blood. And then they'll send for a Western blot test, which is still, as far as I know, being sent to the States. I think the new hospital in Toronto has an infectious disease center that is going to be doing all that. Vancouver's Women's Infectious Disease Center in the Vancouver Women's Hospital, I think I'm making that up, there isn't a Vancouver Women's Hospital, medical center, something, they're looking at doing what we're talking about with the multiple stages of treatment. So the original antibiotics, non-traditional treatments, traditional, and then documenting what works. Except the 3 doctors who came to do that were so disappointed that it wasn't happening that now 3 of them have left, and I don't know if they've replaced them. I tried to look that up, and I just got a completely different webpage, so that told me something. But if you do the Western blot, because you either found in the ELISA test that you had spirochetes, or because you're going to do it on your own, a couple $100 for each variety that you're testing, you'll get whether or not you have borrelia DNA in your system, but it won't say anything about when or where it's located or whatever. And you'll have host your own genetic markers for borrelia immunity. So your system has done some work on counteracting Western blot. So when I got these back from California, what does that mean? It still puts me in the same place. I need to strengthen my immune system, do everything I know to do about health, document my symptoms, etc. And then the new part with the Western blot is some folks, like the Scottish recently, have gone for location-specific borrelia. So all the bands, the 130 plus, are not on Western blot. Which ones do we actually need to test for? So Scotland found out which ones were more specific there, and now they're getting very different test results. And then the other thing is, in some protocols, clinical diagnosis is both accepted and preferred, and the test can be a backup to that. So Canada is in the process of deciding how they're going to do that, if they're going to stay with this ELISA first as a gatekeeper, or even have to, another gatekeeper is having been in an endemic area or knowing you had a tick bite. So what I find is the doctors here, because this was a huge issue when I was in California too, the doctors here are so open to trying to figure it out with you. But because it's not endemic here, none of us have much experience with it. So there's definitely ways through. Testing, we've talked about that, whether it's going to be blood tests. There's now skin tests at the site of some of those infections. So if you have the big red infection, they can do skin biopsies and test for that bacteria. Some of those have been very effective, but some not. Another one that was just sent to me was, this would be under CSUSF, so California State University, San Francisco. There's a picture of heat detection of the different borrelia signatures, and the top one is really orange, and the bottom one is orange and blue, and the very bottom one is much blue and a little bit of orange, where that patient is working their way through that inflammation level. So that's a whole different answer to how to look for the infection and whether it's improving or not. And then we did that one. So, symptom controversies. If you have a bite, a rash, a site reaction, flu-like symptoms, that's a good time to raise a question. Might this be a tick infection? It isn't necessarily, but it might be. Then you go into neurological kinds of issues, whether it's central nervous system or peripheral. Dermatological issues, this is more common in Europe, especially in England, with all kinds of rashes, lesions, discolorations, thinning of the skin. They call it glassy skin, where you can just scratch yourself and it'll be bleeding. Not so common here. Ophthalmological issues that may start out as blurry sight, sharp pains in the eyes, double vision. My guess is that's probably related to the the nervous system connection. Joints, we talked about. Popcorn neck is another one where you can turn your head in a circle and it'll sound like Alex is making popcorn. That's now gone for me. Musculature, fibromyalgia, chronic fatigue syndrome is huge. That's another one of the specific markers. If all of the things you think might help don't, it could be Lyme or it could be Bartonella, one of the coinfections. And then lymph and venous insufficiency, which can cause that kind of swelling in the leg, where they'll put you on, if it's an allopathic system and you're going for medication, they'll put you on diuretics and in compression stockings, which is really, really helpful until your system starts recovering. Progressive symptoms. So once we've gotten past this flu-like thing, and we've talked about fatigue, neck stiffness, there could be jaw discomfort, swollen glands is one of the common symptoms. Nervous system abnormalities, including memory loss and partial facial paralysis, peripheral neuropathy in the hands and feet, migratory joint pains, pains in the tendons. I'm currently getting shots into tendons that have completely alleviated pain in my right hand was the worst, and also in my left hand, so I can now open any pickle jar you throw at me. And that's what we use as a measure. I take a pickle jar that just used to just tweak, and then when that doesn't hurt anymore, we stop doing the injections. But it's a stimulation of the tendons and the nerves around it to where your body takes over the healing. And that's the transition that I've seen most effective, is when you have to use the big guns like antibiotics because you've become immobile, or loss of kidney function, or loss of the use of your hands. Then as soon as you can, go back to supporting, encouraging your own immune system, including particularly thyroid and parathyroid, as well as adrenal. And then there's more subtle changes, such as memory loss, difficulty with concentration, change in mood or sleeping habits, like, I never knew I was capable of sleeping for 36 hours. My cat did not like that period of time. And then there's the sheer range of symptoms. So our medical system was originally set up in that era, the 1800s and 1900s, when Louis Pasteur and others found a microbe that was it. Okay, this is the microbe that causes fill in the blank. Pneumonia, polio, strep throat, whatever it might be. And that way of thinking is in our way with Lyme, because it's systemic and it's doing its own thing in interaction with your immune system and whatever other viral and bacterial load you have, and previous injuries. So it loves collagen-based injuries, like joint injuries, the separation of a shoulder, for example. So that one, it took me a year to work through the pain and stiffness and odd things that would happen. All of a sudden my shoulder is like, go on shoulder, come with me. And you couldn't pick up my briefcase or whatever. So as soon as I got using collagen supplements, a lot of BioSil has gone into the shoulder. It's now completely functional and I can do whatever I need to do with it. I'm not saying I would unload a couple of tons of hay bales, but so it's that kind of range of symptoms and how to use, I call them the big guns, but there's also serious implications to using long-term, strong, multiple dose and multiple antibiotics at the same time. So you want to, in my opinion, you want to back that down as soon as you can. Common co-infections. So babesiosis, Bartonella are two of the most common. Ehrlichiosis and mycoplasma is one that we're looking at right now for changes in skin. Human granulocytic anaplasmosis, and then there's a whole bunch of information on the Canada Lyme website on any of those co-infections. So once you think you have something going on with the tick, looking at some of those can help you go, okay, this set of weird symptoms is. And in my case, it was Bartonella that came to the fore first, and then start treating that. If we don't do that, look at the co-infections, it's really hard to treat Lyme. And in Australia, where it took quite a while from the time they were endemic to the time when that kind of treatment was being done, looking at what the co-infections were. So here's a list of what in Australia now has -Lyme behind it in patients' record charts, because it isn't whatever we used to think was causing that, it's a part of a Lyme co-infection. Migraines that move around, because people usually have migraine kind of habits. I worked with a woman who had really severe frontal migraines, and it was pretty much started the same and it was pretty much in the same place. But if your migraines move around, you might want to think about whether that was Lyme. So in summary, diagnostic controversy is a part of the controversy. Which tests, which symptoms, and where were you exposed? Treatment is a part of the controversy. For, holy moly. So, we've talked about most of this, the combinations, how research is impacting treatment. I'm going to end with this one because this is some of the new stuff. The body temperature is dropping. So when I first started recording, I was in the early 90s. Now I'm up to about 96, getting more normal. When you're really cold, that really impacts pH and blood sugar. So that's one of the new areas that you're looking at, a really easy way to help your body's immune system deal with that bacteria. The bacteria likes cold, the immune system likes stasis, likes it more even. Another major new area is bacteriophages, which I'm calling master immune cells. So meta-immune cells that are adaptogenic, they can go either way. They will either work with supporting good bacteria and getting, for instance, digestive systems after antibiotics back to being functional, or they'll work with the 15% that for humans is still normal of microbes that are not so helpful. So your body most of the time has about 15% not so helpful microbes in it. And you could find all kinds of different things in there depending on what you've had and what you've been exposed to. Your immune system mostly just handles that and keeps it in the background. So that's a huge area of research right now, is how do you support the bacteriophages, part of your immune system, to know they need to stay active. Another part, we talked about the heat signatures that CSUSF was looking at. Then there's new strains. I think, my memory's starting to mix these slides. I think what it was Miramati, which was one of the main Japanese Lyme strains, has been found here. And then this one is a major area of research. Lyme has persister cells within its cystic or matrix or biofilm forms. Those persister cells go dormant, and then they can, when the situation is right, like you've stopped your antibiotics, reactivate. The fact that they're covered or encased in host proteins make them really hard to find. You can't test for them. And it means they can last a long time in the person. This is different from resistance to antibiotics, which also happens. But it's a very different thing than the cycle of persister cells in borrelia. So we need to be working with both of those. Do I need to change antibiotics, come off antibiotics and go to herbals? Or keep myself really, really warm? Fever is a good thing. And some of the co-infections actually help you heal the Lyme because they keep your temperature up. So you might not like drenching night sweats, but for the Lyme part, it's a good thing. For the mycoplasma that's creating that fever, you're then going to have to deal with that. So there's all that part. Here's a really odd one I just read about, was when your toenails go to 45 degrees, whoop, they're going up instead of out. One of the things in the Lyme situation that causes that is the breakdown of the collagen in the joints of your feet. And then it tends to get deposited there. Or it can be candida infection from the antibiotics. So they're looking at that. What are some examples of symptoms that are really specific to Lyme? And you don't see them in other ways, like when you do have one of those bullseye rashes. And then there's a lot of research going on in pulsing of the medications, whether it's alternative herbal medications, homeopathics, antibiotics, in the 4-week cycle that Lyme tends to work off of. And then using support therapies, like lymph massage has been just amazing for me in healing my legs. So now I've learned to do it myself, and I know when I need it. And when we can get to that point as a way to take over yourself doing it, you're on the way back uphill, as we said, climbing that mountain, but from a point of health versus I'm on ice with no crampons. So thank you all for being here and sharing just one person's view of a Lyme journey and how we don't have that much to worry about yet in the Northwest, but still a good thing to be aware of when you're out there.
I'd like to thank Verna for coming in and giving an interesting talk today.
What's the best thing to put in this cup if you have Lyme?
Lemon juice.
What did Bob give you the other day?
Oh, that Labrador tea?
There you go.
The answer is, and yes, that is one of mine, the answer is it will be very specific to each person. But yeah, Labrador tea was very helpful.